Hey everyone, my name is Lamarana. Welcome to the Halatafricashow. If you're new to this channel, please subscribe, share and click on the notification bell. It is yet another exciting day today. I want to talk to you about the healthcare sector in the Gambia and some of the opportunities that are there. Especially in this COVID-19, we know that the healthcare system for any given country is one of the most important sectors. So therefore, a healthy nation is a wealthy nation. And today, we are going to dissect into some of the challenges that we have in the Gambia and also the opportunities. As you may know, there are few factors that you look at, if you want to know how developed a country's healthcare sector is. And the first one is the responsiveness of the healthcare system. The second aspect is going to be how efficient the healthcare system is, also the quality of the healthcare system and the affordability. Also, you have the distribution of the healthcare infrastructure itself, because you'll find out that when you go to certain developing countries, most of the healthcare facilities are situated in particular areas that are considered as the most developed. And this is very true for the Gambia. If you live in the Combos or Western Division, you are more likely to access these healthcare systems easily than somebody who lives in the provinces. We can also look at some of the statistics in the Gambia to understand why we are facing some of the challenges that we are facing within the healthcare sector. The government spends about 6% of the GDP on health, which I think is very small. It is a very poor investment on the side of the government, because healthcare is one of the most important sectors for any given country. So therefore, the government should invest heavily in the healthcare sector to promote the health of the country, because once the citizens are healthy, your country will become a productive country. And once a country is productive, therefore, we will see economic and social development across the board. And this is not what is happening in Africa and Gambia in particular, because the government in the Gambia or across Africa are not taking the healthcare sector very seriously. And this is reflective of what is happening right now in this COVID-19. Our healthcare system in the Gambia is severely challenged, and if you look at the numbers, you can tell. For instance, we have about 5 major hospitals across the country, and looking at the size of the population, I don't think this is enough. If you look at the physician-patient ratio in the Gambia, for every 9,100 patients, you have 1 physician. You look at the nurse to patients ratio, for every 10,000 patients, we have 0.87% of nurses available. You also look at the availability of beds in our hospital. For every 10,000, we have 11 beds available. So these are some of the challenges that we are faced with within our healthcare sector in the Gambia. And this is where we need investment, and investment from both the government and that of the private sector, if we want to change the healthcare problems in the Gambia to make it better for each and every one. So these are some of the challenges that we are facing within the healthcare system. So with challenges also comes opportunities. What are some of the opportunities that are available within the healthcare sector in the Gambia? They are numerous. For instance, we need a pharmaceutical industry in the Gambia, wherein we can manufacture some of the PPEs that is needed for the healthcare workers. We don't have any of these. So almost all the PPEs are imported from other countries. So for us to create, employment opportunity within this sector, I think we can invest by bringing in factories that can manufacture PPEs, drugs, vaccines as well. There is also the opportunity, you as an investor, you can also build hospitals, health centers and clinics across the country, because this is going to help make healthcare services accessible in the country and also affordable. You will see that, or you will understand that most of the healthcare systems in the Gambia is insufficient. So another opportunity also is, we need more pharmacies in the Gambia. Access to medicine is not the easiest thing in the Gambia, because we have pharmacies centered just within the combos and that of Western Division. So if you should invest in building pharmacies, it is a good business opportunity for any investor. Also, we have seen the advent of telemedicine in the West. This is lacking in the Gambia. It is also lacking in most countries in Africa. So if you should invest in telemedicine, it is going to help the country a lot. Mobile health also is another issue. We don't have that in the country. Like, let's say in advanced countries, you as a patient, if you have an appointment with a doctor or a physician, you are reminded through text messages. You can easily access information regarding your health or appointments on your cell phone. So these are areas that I think if we should invest in, we will be able to improve our healthcare system in the Gambia and across Africa. As an investor, I think it is always important for you to be very innovative. Look at some of the areas that are lacking, in various sectors. It doesn't matter which country you are in, and take advantage of, the needs that are available. Because in the Gambia, technology is a huge challenge, and because of the lack of technology, it is basically affecting every sector in the country. Another opportunity also in the Gambia is to build schools that will teach our citizens about health issues. For instance, we need more nurses, we need more physicians, we need more doctors in the country. But let's say, for instance, the Gambia College School of Nursing Department, they only graduate 35 nurses every year. This is not enough at all. I think they need to build the capacity. They need to enroll more nurses into the program. We need to quadruple that amount every year, because we have to understand that once these nurses graduate, the country is not retaining all of them. Some of them are traveling outside of the country to go and work in other countries. So you find out that we are severely challenged in the areas of human resources. For the healthcare sector, we don't have enough doctors, and this is evident right now as the country is going through this COVID-19. The cases are increasing, our healthcare workers are getting infected, and the citizens cannot easily access the necessary health services in the country because of we don't have enough human resource persons in this sector. And I also think in the areas of doctors and physicians, the University of the Gambia can do a better job. Let us encourage our upcoming applicants at the university to go into areas like nursing and learning about medicine, because it is one of the most important sectors. We need more physicians, we need more nurses. So I don't think I can overemphasize this point. It is important. Our healthcare system is one of the most important. So therefore, let's do something better. Of course, I understand the reason why people are not going into the medical field to become practitioners in the Gambia is because our healthcare workers are not paid very well. And this is where I think the government should come in. Encourage the people by making sure that our healthcare workers are paid very well. Give scholarships the people who are interested in becoming physicians, or nurses, to pay for their tuition, because we cannot allow our country to be the way it is. Our healthcare system should do a better job. And the number one thing that you can do is to encourage people to make that sector a viable sector. And the only way we can do that is first to make sure our nurses and our doctors, physicians are getting good money for their work. And also, let's give them all the support that they need. Let's provide scholarships and many other incentives as it is done in other countries. So with that, we come to the end of this video. Please subscribe, share, and click on the notification bell. Until I come your way, this is Lamarana, Halatafricashow. Bye.